Well, Josephine, are you on? Josephine, I see your
Okay,
camera.
okay. I just unmute myself. Yes.
Yes, please. Can you please take roll call?
Okay. I'm admitting one more person. Okay, roll call.
You're doing the meeting room?
Yeah.
Josephine, we can't hear you.
Okay, Hoki Balas.
Here.
Or did she? Yeah. Beverly Hotelli,
Here.
Louis Johnson,
Here.
William Hinaka,
Here.
Stephen Long,
Excused.
excuse, okay, Sarah Medeiros,
Here.
Sally Ogata,
Here.
Susie Sober, Marilyn Seeley,
Here.
Barbara Service,
Here.
Gary Simon,
Here.
Lisa Spencer,
Here.
Rick Tabor,
Here.
Leslie Tanoy,
Here.
Raylene Teno.
Here.
Okay, we have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13 members. We have a quorum.
Thank you, Josephine. Okay, this afternoon, we have joining us is Elaine Lee with the MedQuest division under the Department of Human Services. And they had gotten in touch with us a few months ago to do a presentation about dual eligible special needs plans. So Elaine?
Okay. Hi, everyone. I'm Elaine. I'm a contract specialist with the Department of Human Services in the MedQuest division. And can you see my screen? I'm going to do a presentation on DSNPs. Can everyone see my screen?
No, not yet.
Okay. Okay. Okay, hold on. Okay. Let me
Okay,
just,
there we go.
Okay, perfect. Okay, so today I'm just going to go over some general background information on what a DSNP or dual eligible special needs plan is, and a new policy change that will be taking effect starting January 1st, 2027, and then also go over an action item that MedQuest is implementing due to this new policy change. Okay, so our first slide, so here's our agenda. So first we'll go over like what is a dual eligible special needs plan, also called a DSNP. And then second thing we'll go over is the federal policy change. And this will be starting January 1st, 2027. And then third on our agenda will be the Medicaid reassignment. And this is our action item that we're implementing due to this new policy change that's starting January 1st, 2027. And then after that, we'll have time if anybody has any questions. Okay. And okay, so our first slide is what is a dual eligible special needs plan, also called a DSNP? Okay, so a DSNP, a dual eligible special needs plan, it's a Medicare Advantage plan that combines Medicare and Medicaid benefits under one coordinated plan for people that are eligible for both programs. DSNPs are required to provide Medicare Part A, Medicare Part B, and Medicare Part D coverage while also coordinating care with the member's existing Medicaid benefits. So DSNPs, they coordinate benefits from both Medicare and Medicaid into a single streamlined plan, which makes it easier for members that have both Medicare and Medicaid to manage their health care. Okay, so now next on our agenda is the federal policy change. So this is going to be starting January 1st, 2027. And so starting January 1st, 2027, federal law will require members to be enrolled into the same health plan for both their Medicare DSNP and Medicaid health plan. So for example, if a member is enrolled into United Healthcare's Medicare DSNP, they would also need to be enrolled into United Healthcare's Medicaid health plan. Okay. And so having the same health plan for both Medicare and Medicaid benefits makes care easier for members. So by having the same health plan for both their DSNP and Medicaid, a member will just have one member ID card, one care manager, one member call center, and a single unified grievance and appeal process. And they'll have one health plan to manage most of their care. And okay, so right now Hawaii has about 5,000 members that are enrolled into different health plans for their Medicare D-SNP and Medicaid. And okay, so now we're going to go on to this is our action item. We're calling it the Medicaid reassignment. And okay, so after December 31st, 2026, if there are any members any member that has different health plans for both their Medicare D-SNP and Medicaid, they will be disenrolled from their Medicare D-SNP. So to prevent, so if a member is disenrolled from their Medicare D-SNP, they would then have to select alternative Medicare coverage, such as traditional Medicare or another Medicare Advantage plan. However, unlike D-SNPs, these Medicare options do not coordinate with the member's Medicaid health plan. So, okay, so to help prevent members from being disenrolled from their Medicare D-SNP, MedQuest is going to perform a one-time Medicaid health plan reassignment on August 4th, 2026. So this one-time Medicaid reassignment will allow members to remain in their current D-SNP for Medicare, and MedQuest will move the member's Medicaid health plan to align with their D-SNP. Okay, so here, this is an example of what the Medicaid reassignment will look like. So, for example, this member here is enrolled into United Healthcare D-SNP and HMSA Medicaid. So, MedQuest is going to move this member's Medicaid plan from HMSA Medicaid into United Healthcare Medicaid. So, after the reassignment is completed, member would then be enrolled into United Healthcare for their D-SNP and United Healthcare for the Medicaid. So, they'll have the same health plan for both their Medicare and Medicaid benefits. And okay, and so members that have different health plans for the Medicare D-SNP and Medicaid, plans that are receiving LTSS, which is long-term services and support, HCBS, which is home and community based services, and CCS, which is Community Care Services for Individuals with Serious Mental Illness. These members will all be excluded from this one-time Medicaid reassignment. And the reason we're excluding these members from the reassignment is that we want to prevent any potential care disruptions for services where Medicaid is the primary payer. However, the federal law, taking effect January 1st, 2027, which requires members to have the same health plan for their D-SNP and Medicaid benefits, will still apply to all these members. So therefore, we're encouraging health plans to conduct their own targeted outreach to these members and work with them to ensure that they have the same health plan for their Medicare D-SNP and Medicaid. Okay, and then that's it. Does anybody have any questions?
Can she send the slides because she talks so fast? It was hard to keep up.
Oh, okay. Sorry, sure. I'll send the slides after. Sure. Okay.
Somebody had a question.
There was
Yeah,
a
about
question in
special
the chat.
needs. How do you define special needs? Yeah.
That was a good
Um,
question.
So it's a person that they call it a dual eligible. So a person that is eligible for Medicare and Medicaid. It's considered a special needs. They're eligible for DSNP, dual eligible special needs plan.
That's a duplicate. Okay. Okay. Any other questions?
So if they don't actually transfer over and they lose coverage, what's involved in getting re-enrolled?
Good question.
Okay, so if they want to, they can re-enroll anytime they want, as long as they're in the same health plan for their Medicare DSNP and Medicaid.
No penalties?
Yeah, there's no penalties.
What other Medicaid besides United Healthcare is available?
So there's HMSA, Aloha Care, and Kaiser.
Thank you.
I heard United Healthcare might be leaving the state. Did I hear that correctly?
No, United Healthcare is still planning to stay.
Mhm. I mean, it's good to ask. I
this-
mean,
Yeah, somebody that's pretty credible
You
said
know.
that.
right. Okay.
Hi, this is Corey Kikina. I'm also with MedQuest Division. I work in the dual special needs plan space with Elaine. And I just wanted to clarify the question that was asked earlier about how to help individuals when they lose coverage.
Yeah.
You know, at any point in time, there's a Medicare rule. Medicare will allow individuals to change their Medicare plan at any point in time if the purpose is to align with their Medicaid. So right now, as you know, a dual for us is an individual who qualifies for both Medicaid and Medicare. So they're special, right? They qualify for they've hit the age factor to qualify for Medicare, but they also hit the income factors that makes them qualify for Medicaid. So when they're in Medicaid health plan, they have five to choose from, right? HMSA, Kaiser, Aloha Care, United Healthcare, and Ohana. And if they qualify for Medicare age and they're in a Medicare plan, they can be in a DSNP. The DSNP is only allowable if you're both Medicaid and Medicare. So only a full dual can be in a Medicare DSNP. And otherwise, the other options for individuals for Medicare, if you're full Medicaid, you could be in a DSNP. Otherwise, you can be in original Medicare, fee for service, or you can go and buy a commercial plan, right? A regular Medicare Advantage plan that's offered by HMSA, Humana, United Healthcare, right? But what we're talking about here are the unique duals who are Medicaid eligible and Medicare eligible, and they are in a DSNP. So if they're in a DSNP and they're not aligned, like if you're an HMSA Medicaid and you're in United Healthcare for your DSNP and you're not aligned, at any point in time, Medicare will allow the DSNP portion to change your plan and align to your Medicaid. If your purpose is to align and be in the same Medicaid, Medicare plan, Medicare will allow you to do that at any point in time. So when you ask if there's any penalty or anything like that, let's pretend the person's in HMSA Medicaid and they're in the United Healthcare DSNP and they don't ever change their Medicare to align to their Medicaid plan. And then United Healthcare will be forced to send a letter to their members saying, oh, you're not aligned, we have to drop you. At that point in time, that member can align and choose Medicaid HMSA, and choose HMSA DSNP and align themselves with no penalty, as long as they're going in for alignment.
Thank you.
Sure.
And there was, Janelle put down in the chat that, thanks, Candace. If you have Medicaid or get extra help, you can make changes to your coverage once a calendar month. The change will take effect on the first day of the next month. Okay, so that was just clarification there. Then the next one is, are all Quest providers also Medicare providers in the state?
The answer to that is yes. So that's required by contract. If you're a Medicaid plan in our state with us, state Medicaid agency, you are required to provide the Medicare DSNP.
Okay, thank you. Okay.
You're welcome.
Hi, thank you guys so much for this presentation and the heads up. I have a few questions, a few that are really short, and so please stop me if it gets. But one question I had is why the carve out for those populations, and how is the reassignment being done? Like, how are you choosing what plans they're going to? Is it random? Those are
So, okay. Oh, for the members that are in the LTSS, those members, is that what you're asking? Why they're
carve out is happening.
okay, so we're exempting members for like that have LTSS and HCBS and CCS because Medicaid is a primary payer for most of those services. So we don't want to disrupt like any like provider like networks or any care disruptions. So we're encouraging like health plans to work with those members to get them aligned.
Okay. And if the health plans don't, because they're still subject to this rule, right? So I think to Rick's earlier question was if people fall through the cracks, which we know happens all the time, and if things aren't coordinated, will they have to reapply following the same application process that everybody who either gets denied or is reapplying for the first time, will they have to go through that all over again?
That's a good question. Corey, do you know?
So, are you asking for the application process? Are you asking about a Medicaid application or are you asking about the Medicare?
Well, in a presentation, and excuse me, because I have to agree with Barbara, like it was very fast, so I'm trying to keep
No
up.
problem. Yeah.
The federal rule will still be applied to that
Correct.
populations, but they are being carved out or excluded from the Medicaid, from the reassignment that all of you are doing. And the answer was that you guys are encouraging the health plans to work with them to realign with the new federal rule that's coming in January. So if the health plans do not take it upon themselves, if they fall through the cracks, if it's not aligned with the new federal rule, then do they have to reapply and follow? I mean, are we asking this subpopulation and their health care plans to do it on their own, which we know will cause a lot of disruption and will not be the easiest task to do, as we know when we're navigating these government systems. So if it does not happen, what will happen to all of these, to the carve-outs? Like how,
Right. So what will happen is the Medicare plan, so the DSNP, right, they will be required under Medicare law to give a notice to the member, probably a few months before the end, before the end of the time frame. So probably like in 2026, they're going to give a letter out and they're going to say, member, you are not aligned to the right, you're in an unalignment plan. So like you're in HMSA Medicaid and you're in United Healthcare DSNP. Since you're not aligned, we're going to have to remove you from our DSNP because that's what the Medicare law requires. So they'll get notice about that. And at that point in time, hopefully the member will take action to either choose HMSA Medicare DSNP and align, and then they'll be fine. If they don't, I mean, because that, a lot of times, our elderly population, it's hard, right? To get the mail, to take action, to do things. If they don't, then worst case scenario after that, United Healthcare will have to drop them. So then they'll have no coverage for their DSNP, right? For their Medicare. And at that point, then the member will have to go into original Medicare fee for service. I think that's what happens. I mean, I'm not in the Medicare space, so I don't know exactly what happens to the member at that point. But see, there's going to be a lot of work done ahead of time to ensure it. So as we're moving in this direction, state Medicaid agency, us, is going to notify all the health plans of their members who are in long LTSS or CCS, those who get their primary services from the Medicaid plan, that most of them have care managers, if not all of them. And they're going to work with the member and do outreach to help them align,
okay,
right? So
That's gonna
we're
be-
hoping that we catch them all there, right?
correct. I understand that. And so
Yeah.
because as you mentioned, the populations that are being carved out many times need help to change these processes. It's not an easy system. Also, the letter
No.
for
Yeah.
Medicaid or Quest, like I get them for my family member, are very difficult
Mhm.
to understand. It's written in language that's not lay language, that's not easy for members to understand. So I'm really concerned about everybody who's going to be receiving these letters and these calls. Like, where is the pre-education to inform them about what's happening, what this means? There's a lot of work that goes into preparing members for this, especially when you're carving out those special populations. So, I mean, thank you for addressing it, but it also seems like there needs to be a little bit more, I guess, help set up for them when they're reaching out to try to understand what is happening. And I was just wondering, when you guys are in the process of the Medicaid, of your own reassignment that you have chosen,
Mhm.
how is that process? Is it just randomly that you guys, or how
Oh,
are you?
that was the question. Yes. So it won't be random. What it will do is, because the federal law requires them to be aligned, right, in the same Medicaid plan and the same Medicare plan. If you're HMSA Medicaid and you're United Healthcare for your Medicare, in this Medicaid reassignment process, we can only touch the Medicaid plan, right? We can't touch their Medicare plan. So we're going to take HMSA Medicaid, take the member out of HMSA Medicaid, and put them in United Healthcare Medicaid. And then they're aligned with their DSNP plan, their Medicare plan. So Elaine has run the numbers and knows, I'm not sure if you have them now in front of you, Elaine, but the number of people who are actually unaligned is not that big of a number. Because we have worked for the past 5 years to drive alignment, right? To put people in this, to encourage people to align their Medicaid and Medicare so that it can look like one seamless plan. So right now, I think we're probably like 65, 70% alignment. Oh yeah, Hawaii has 5,000
Yeah.
members that are enrolled in different health plans. So So that's the reach. If we're looking at of our members, there's 5,000 of them who are unaligned right now. So we are going to try and fix all of that ahead of time before, before the change takes place January 1, 2027. So we will do the Medicaid reassignment ahead of time, I think in August. And then also before that, we are going to be giving all the health plans, a list of members who are unaligned so the care managers can do the outreach and help them align themselves. At the very end, like if all those people fall through the cracks, the Medicare plan will also be giving notice to the members saying, hey, you're not aligned, you're going to lose coverage. At that point, the member can call the DSNP plan and say, can you help me? And they're going to direct them. Yes, you can go here, you can go there. SHIP should be available to direct them. MedQuest Division Call Center can also help them. But I think the biggest help to these members will be their existing Medicaid plan. Because their existing Medicaid plan, of course, will want them to join their Medicare plan. So if I'm HMSA Medicaid and I'm United Healthcare for my Medicare, and I get the letter from United Healthcare Medicare saying I'm unaligned, I call HMSA Medicaid, my Medicaid plan, can you help me? They'll probably direct me over to HMSA Medicare, DSNP, and give me a worker that'll help me transfer and transfer so I can align my plans and be in the same one.
I appreciate.
Yeah, we tried to give a lot of education to the health plans to help those members especially, right?
Yes. And so I
Yeah.
appreciate your responses, and I do appreciate everything that you guys are doing to try to set up to make sure that members are in aligned and they don't lose their coverage. I'm just concerned about those who do fall the cracks or are unable to, get the help, and then they'll get the letter saying they're, not in alignment, and then
Mhm.
still lose all of their coverage. And so, is there going to, call centers, but like I have to call Quest all the time, and the wait is
So
long.
long,
Know
yeah.
that you guys are doing your best and understaff, and I
Yeah.
thank you guys all the time for your help with everyone and appreciate it. But I just guess I'm just worried about you know, what we're going to have for those who are going to need a little bit of that extra help. But I appreciate that you're going to let the health plans know and do the reassignment. But I'm
Okay,
starting.
okay, I think that the next question that came up would kind of address what you're asking about. So it said, who would the recipient contact to re-enroll or make changes to their health plan to be one single dual plan?
So they
So I
would
believe
call
they
their DSNP, the DSNP plan. They would so they would want to enroll in whatever DSNP plan that, and then
So who would
they
they
would.
call? Would they
So
call?
so we have a list on our website, and it has like a list of all the DSNP plans, and that's who like the number. It's on our DSNP on our website, our MedQuest website, under the DSNP section, and it has a list of all those plans, and they can call those plans, and they'll be able to help them get enrolled.
Okay, and so let's say I'm the type of person who doesn't know how to use technology well, or I'm in my 90s and
Mhm.
my family isn't around to help me. So how would I be able to access this?
That's a good question. So go ahead,
Oh, yeah.
Corey.
Yeah, Elaine, I believe they also can call Medicare. If they just called whatever during open enrollment for Medicare, if you contact Medicare and you let them know that you want to choose a different plan so that you are in alignment, you can do that at any point in time. So
Okay.
normally Medicare has rules, right? You can only do like special enrollment period, open enrollment period. But we were told by CMS Medicare that at any point in time, any Medicare member that wants to call into Medicare and change their DSNP Medicare plan to make sure that it aligns with the Medicaid plan, they can do that at any point in time.
Okay, and so Janelle put that, yes, you can contact 800
Oh, thank
Medicare,
you, Janelle.
or,
Yeah.
or pages 1 and 3 are helpful for this topic. Okay,
And
Caroline?
also Hawaii ship, as they mentioned
Yeah,
earlier.
and Hawaii
Yeah.
ship. Okay, okay, Priscilla?
Hey, hello, I'm Priscilla Thody. I also work with Elaine and Corey in MedQuest. I want to clarify that we are looking at the DSNP members to move their DSNP plan from now till August.
Correct.
Once
Correct.
August comes, we will move them their QI plan. So we cannot move their DSNP plan, but we can move their QI plan. So we're hoping majority of the unaligned beneficiaries will be able to move their DSNP plan.
Okay.
Those are
Thank
good
you.
questions.
Yeah, but thank you for the clarification. Any other questions? If not, we'd like to thank you all very much. I mean, you've kind of given us information that if we know somebody who has these dual plans, then we can at least go out and tell them, hey, this is coming up. You need to start making changes. So thank you very much. And you ladies have a great afternoon. Thank you.
Thank you.
Thank you.
Thank you for all the great work you guys do too. You know, we love our duals population and we love working in this space. And so we're just trying to make it easier because we all have parents and we're all going to get there too someday. So thank you for everything you guys. Like I first I'm
Thank
like,
you.
oh, I do the duals work. What do I have to do this for? And then I'm like, oh, this is so important. I need to know these things, right? You know, not just for like my parents, but for myself and my friends. And yeah, so thank you very much for everything all of you do.
Thank you.
Thank you.
Take care. Bye-bye.
Bye.
Thank you.
Okay, you take care and good luck. Okay, minutes from the draft of February 2026. May I have a motion to accept the minutes? Okay, it's been moved by Shelley, seconded by Marilyn. Okay, any discussion about the minutes that were distributed via email?
Yes.
Yes, we do. We still have quorum. We had 13 at the beginning, so we still have quorum. Yes.
Sarah, under the unfinished business, I think we made a correction for under food. So, we added farm and family hubs, food hubs.
Excuse me. Okay, hang on just a second, sir.
That was added last month.
We also have the recordings, so
Yeah,
Yeah.
it's in the recording, so that when Josephine goes back, she can look at that to
yeah.
correct the minutes.
Right.
So what was I supposed to read?
Farm and family hub.
food hubs. Farm and family food hubs.
Family food hubs.
And so it says SNAP, farm and family food hubs, CSA, boxes reduce cost, and I think we said, never mind the community gardens, because that is a county. City and county. Function.
Oh,
Okay. I didn't
Probably-
make a copy
Yeah.
of the minutes, so
probably, oh, I'm so sorry.
That's
Oh, my
okay.
dear.
Thank
Never
you.
mind.
thank you. Okay, Carolyn, you wanna ask?
I would probably recommend we go back, we can just that part on unfinished business, we can look at that. We'll note the note what you brought up, and then we'll just go back to confirm it, and we can, maybe motion to accept it the next.
Draw my motion.
Yeah, okay.
Okay, after discussion, okay, thank you.
Yeah, that's okay.
My suggestion would be to table this until
Yeah.
our next meeting.
Yeah,
Okay,
And we'll-
because we need clarification on the minutes. So, Josephine, Shelley has withdrawn her motion and so has Sarah. And we are going to table the minutes of February 6th for further clarification.
Yeah.
Okay,
got it.
all right? Okay, thank you. Okay, reports, executive.
Oh, okay. I do all owe you, sorry, that's last time's minutes. A huge apology. I did not get out my written report. So what I'd like to say for the record is I'm going to stick to the topics that I outlined in the agenda. And I'm going to share with you these 3 items, and then I will ensure that a written report is done after the fact. So as far as updates on federal funding, we do know that the federal funding for the Older Americans Act has passed. We've seen increases In Title 3B, support access services, we've seen a slight increase for the National Family Caregiver Support Program, that's Title 3E. I think all the other funding, I'm trying to remember from our staff meeting, has remained flat at the 2024 level, which I know last month when we were discussing this, that really with the high increase in cost is really kind of a downward trend, but we are monitoring. SMP money is intact. The state health insurance assistance program monies are intact. I believe all of Title VII monies are also intact at the 2024 level. But yeah, so that's what I have as far as federal updates. Again, I think this is one thing, and I brought this up at the Meals on Wheels march the other day, is that this is one area where everybody can kind of come to agreement on, because everyone's going to get older, right? So I think, and when it touches their constituents, it's touching their families, their loved ones. We get that bipartisan support. So it's a good thing. We are, you're not going to believe this, starting our 2027 through 2031 planning process. So both EOA and the counties have come together to start on that process. We're going to be starting with our needs assessment. So working with the planners at each of the counties, working with Jason Wong, our statistician, we're going to be looking at the needs assessment that we want to get out in the community. Needs assessment of the older adults, needs assessment for our caregivers, looking at where there's gaps. We also want to do a broad reach to all of our service providers and stakeholders in the community to see what are some of the challenges and barriers that they're also facing, so that when we're developing our approach and our strategies to align with our aligned goals that we're looking at, that all of those things are taken into consideration. So again, this is a very early stages of this. I am not happy to report that we're still doing it without a planner. We still don't have a planner here at the Executive Office on Aging, but this needs to be done. So we're putting work to that. Shelley?
Question, I was wondering if the committees on aging are going to be tapped as well
I would like
For
to,
that.
yes.
for help developing, especially some of the protocols for the
For
needs assessment,
distribution, maybe too.
for the needs assessment.
Yeah.
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 Or even the approach and the question,
Yeah.
right? I mean, because
Mhm.
they're the ones in the community that are
Yeah.
gonna be,
Yeah, they hear all that,
Yeah,
right?
yeah.
Yeah. So, we had one in-person meeting, and we've had one, one by Zoom, but that, I will take that back to our group to remind them, please tap
Mhm.
your councils on aging, because they can be committees on aging, they can be great resources. So
Exactly.
yeah, thank you, Shelley.
Yeah.
Thank you
Yeah.
for
Does
that.
every county have?
They do, it's required, yes.
Okay,
Yeah.
and they're all filled up and they all have people and.
I can't speak for the counties,
What's the official title for the counties? It's not called, is it called Committee on Aging, Shelley? I don't think so, what?
The Hilo
No.
Islanders, I mean, the Big Island,
yeah.
White Island is called committee.
You know, I'm sorry, I do have procedures and policies around this, and I can't remember the exact
Okay.
title, my
I remember
apologies.
when
Just-
soccer-
Okay, thank you.
Yeah, but I think they do meet the quorum for their requirements of their bylaws, but Marilyn.
We
go
could have
ahead.
a whole section there on workforce, and is that still a major issue?
It is,
For the
yeah.
providers across, and is that translating into unexpended funding?
Okay, that's a loaded question, but it's a good question, so I am gonna try to answer it. We have valleys and we have mountains peaking. So I would say in Maui and Kauai, they are on par with expenditures. And are serving their community and have actually expanded. So when you look at the individuals that are being affected at the county level, I mean, the people that we're serving, both Kauai and Maui have actually provided additional services. So instead of just a touch point, sometimes they may be getting 7 meals a week if needed, right? Or they may be getting additional adult daycare and things like that. So they are in par with their expenditures. I think for Hawaii County, I know they're really suffering on providers.
Yep.
And then, separate issue for Honolulu, but still, even Honolulu, as big as we are, and the grasp of people at 75% that we have to, provide services for, as far as population size, we just don't have enough providers. But every provider capacity is across all four
Well, everybody
counties.
wants to have providers. Nobody's holding back volunteers. They want them and they want the money expended. My concern is, are they gonna look at unexpended funds and how's that gonna affect our budget? That's in the past. I know they're
Well,
looking at, taking away all of the unfilled positions.
Right,
Mhm.
but they've been looking at that for a while.
Yeah,
though,
they have been.
Madeline, yeah.
Well, I'm always
Okay.
worried that they go beyond the
Mhm.
looking at it.
And
they're
actually
trying to do it,
apply
but
it.
They're all trying to save money. Karen.
Right,
And so
Okay.
this might be another source of money, unexpended funds, as well as, unfilled positions as a source, and that
Right.
will hurt us greatly.
it will,
And
yeah. So I'm actually trying to look at ways that maybe we could bring in people on 89-day hires, because if it's even filled with the 89-day hire, they will look at it as a filled position.
Yeah,
That's
So,
correct.
that's.
So
and-
thank you. That's
Yeah,
very good.
But
to
that,
look
those
at
are
that
good
way.
questions. I'm glad you
Yeah.
brought that up.
Well,
Yeah.
when you read about it, it's a concern. The other
Yeah.
thing I was gonna ask is in the rural
Mhm.
health grant,
Right,
there is a provision for the home health workers that's gonna go to
Mhm.
SHPTA, not us.
right.
Is there any reason for that? It
Um,
seems like it's duplicative.
so we are, and I've been having conversations with SHPTA where we want to make sure that there's not that duplication or silos. We want to be able to work and be able to ensure that we're not creating those silos by these different funding sources. It was very fast in coming that we had to, I think that SHPTA had to turn around what they were going to do with that rural health transformation grant. So it was quick. We were in conversations. So
But they
I
could
don't
have
have
given
all
it to
the
UA, right? Just as an adjunct, because we're looking at using our existing contracts as a way to
Mhm.
make this fast track so that we have something to show by July. So we have existing contracts,
Contracts, right.
SHPTA doesn't.
Mhm.
So I'm just wondering why
Yeah.
that was an exception, because it didn't make sense to me.
Yeah, and
And
can
I'm
I
gonna
share
just
more
drop
with
that
you?
on-
Yeah,
just be
yeah,
good with
okay.
the cat.
And
Yeah.
can I share
And-
more with you later
Yeah.
on that one? Because
Yeah,
I don't,
okay, but I
okay.
know,
Yeah.
before I
Right.
started talking to Jack
Yeah.
about it, I
Okay,
kind of.
so
Right.
thank you. So yeah.
But I do have, yeah.
It is,
But,
cut
yeah.
out.
No, but I will.
But I think it's something
separately on
that the
'cause
two
I-
of you should be
yeah.
discussing
Yeah,
more.
'cause-
No, I
Yeah.
think it has
Okay,
something to
well,
do with all.
and-
So
Yeah.
Marilyn, sorry.
Well, and I will say, it was, they only had like 3 days to turn this around, so. I was brought in a little later and that conversation really didn't happen. They just had to make sure that they got something back on how they were gonna
I'll
use the
follow up.
funds, so yeah.
Thanks, Marilyn.
It sounds very
Yours-
complicated.
Yes.
It is
does.
it is
Okay,
complicated.
So now you're on C.
See. We had a lovely time this morning. We got to go to the volunteer recognition event. That's why Stephen's not here. He's at the recognition event. We told Stephen, you're always a good PABEA member, but please enjoy yourself with your shipmates and SMP. This is the first time that they've had an in-person volunteer recognition event since COVID. And it was really nice. We were doing things by Zoom. That was fine, but it's just, there's value in coming together, right, Bill? And it was a beautiful event. It was, help me with the theme again. The theme was
Something about the wave.
the wave,
The
the
wave.
progress
the progress of.
forward, and
Something
really
about the
about how
wave.
we want to continue. And that's part of what this stuff, all at the federal level with the DSNP and stuff. SHIP will be involved, they can provide some of that, counseling and education around that and outreach. So I think that, it was a great event. We learned a lot about different types of scams, how the community's coming together to help people that have been targeted. And I think there was one thing, and we wanted to bring it back, that everything is requiring people really to go online. You want to get a hold of Social Security Administration, you need to really have that account, right? You can walk in, you can make an
No, she said
appointment.
there's no
No
walk-in.
walk-in,
No
sorry, you
walk-ins. You
cannot
have to
walk
make
in,
a-
sorry, you need to make an appointment.
Yeah.
if you're gonna go see Social Security Administration, if you want to talk with someone face to face. But you can create an account, but it is complex, and there's two logins you can do. You do the
Me ID
UID
or
or-
ID something, yeah.
or
It's the
login.gov.
Login,
So, and one is for,
ID
Medi-
and
thank
yeah,
you,
both of
and
them.
one's for Medicare, and one is specific to Social Security. So, and that's that double, it's that like authentication, double authentication, so that when you get in, your information is not compromised.
Yeah.
However, and it's something we were talking on the way back, is how do people know how to navigate that? It's complex. I did it for my mom. It is complex, okay? And I'm computer savvy, okay? So something we want to think about, or maybe we want to have them come in and do a presentation about, we had a great presentation from the Better Business Bureau. I would love for you guys to hear that. So something for a future PABEA meeting, but I just wanted to share that with you. It was a really good presentation.
They were, I mean, we had all three presentations, okay? Oh, I'm sorry, Caroline, anything else?
I know you want to talk about it too in
No,
your
you go
report,
ahead
but
and
yeah,
finish
that's
yours.
the, next month, I do want to give you an update and status report, and I just don't have it down on the agenda on the Hawaii Dementia Initiative. So a lot of good work around that, a lot of data we're collecting, and I want to give you our next steps, so I will present that at the next meeting.
And
on
give
what
us
we're doing.
plenty of time for that, please.
Okay,
Yeah, I will,
so,
yeah.
okay, going on.
I'll put it under new business,
Okay.
I think.
Like Caroline mentioned, that we both attended the SHIP SMP volunteer recognition. They had volunteers who had been volunteering for more than 15 years. They had
Wow.
about 5 of them.
Yeah.
And they had somebody there that this was the first year that they have been volunteering. Okay,
Was-
majority of it would have been, I'd say they're about
5 to 10.
7 to 8 years. That would be the average of the people who have volunteered. They can always use more volunteers like every place else. So your interest has to be in SMP, which is the Medicare Patrol, or SHIP. And like they said, it's a hand-in-hand kind of thing. And it was something that we all hear. We've had presentations by our staff here, but until you're really involved with it, until you have a question involving Medicare enrollment, okay? Because just to share this short story that I was at another meeting, and this gentleman was going to be 65. His wife is a state retiree, and yet he wasn't sure what he should do when he hit Medicare age.
Mhm.
So we told him the best advice, call SHIP.
Yeah.
Okay, because you know what? SHIP is the best one who can give you all that information.
Unbiased.
And it's an unbiased one, okay? So going on with our report, the director and I have been in contact on various issues together as to where we go forward on some of them. We also have been working on where we want to go forward. Okay, and also we talked about the vacancies that we have as far as PABEA members go. Okay, and who stays on. And I believe we have, today Rick has left because Rick is up for a confirmation hearing, so he's over at the Capitol right now. But we also had about 3 other people, I think, whose names have been submitted or they're in the process of being submitted, so we haven't heard from boards and commissions yet.
So we're crossing
Okay.
our fingers. We know that process is very complicated to, on the website. I know people have had struggles with it,
Correct.
so we got new people. These would be.
These are 3 news people.
Rick's the only one that's,
Actually, the only ones that we know that they have have received notices that their confirmation, their reappointment has been accepted is Raylene and Rick. Okay, others have applied, but they have not heard back from the Office of Boards and Commissions. Like I said, we have not heard, so I can't tell you who it is or who it isn't.
Is
So Stephen also did apply,
But his
but like
name
I
hasn't
said,
come up
his
yet.
name has not come up, and this is just an assumption on our part. Because Stephen and I both applied at the same time, or around the same time, which was the summer of last year. That maybe they're going with the most current applications first, that's the only solution I can say, okay?
But I am
but-
concerned though, because I have given all names
Correct,
over.
Correct,
Yeah,
And
I
then-
actually don't want to, I know it's an assumption, but I actually don't want to prescribe to that.
Well, it could
Because-
be, but yeah.
Because, I mean, is there a way for us to be a little bit more proactive and check in?
Oh, I have been,
His
I have been,
application.
yeah,
Yeah.
I have.
Director has,
Getting
For the last
calls-
2
you get
months.
Callbacks from boards.
Yeah, I am, yeah.
and
Yeah.
also
So we've
that,
been trying to coordinate our list, like, here's my list, here's your list.
Did we
Yeah.
lose his application?
I'm not sure, but but we have been, in contact, I
Okay.
think, yeah.
okay,
Our board
Because-
is very low
Okay.
on priority.
and.
Especially if it's a regular.
Excuse me, can we come back to
We're very-
my report? Okay. I am a holdover till next June, and then I will have to go off this board. Okay, so just to let you all know that. So with that, Gary, I think you have legislative report?
Yep, I do. I'll just go on the actionable items. The bills, the current bills, the caregiver tax credit bill, the House version crossed over to the Senate, and the Senate bill died. The hearing loss state plan, the House version crossed over to the Senate, and the Senate bill is dead. Both versions, both the House and the Senate version of the Kupuna Rent Supplement Program, they're both alive, both the House and the Senate version. And the House version of the First Responder Dementia Training bill, the House bill passed the Finance Committee, and we anticipate that it will cross over to the Senate. The cryptocurrency ATM transactions bill, the House bill died and the Senate bill was heard and passed by wham, so we anticipate that the Senate bill will cross over. The long-term care financing bill, the House bill is the alive version, the Senate bill died. Congratulations, Marilyn and Mel. It passed finance and will cross over. The legislative committee is recommending to the full PABEA board that we support Rural Healthcare Bill HB 1965 and Homelessness Bill SB 2557. The Rural Healthcare Bill establishes primary care providers working group within the State Health Planning and Development Agency to address issues relating to and developing recommendations for the stabilization of primary care services in Hawaii. And the Homeless Bill, SB 2557, requires the statewide Office on Homelessness and Housing Solutions to make an annual report on the number of sheltered and unsheltered homeless individuals and on housing placements, and requires an annual report to the legislature. That's the crux of it. That homelessness bill has passed the Ways and Means. It's a Senate bill, so it will cross over to the House. So again, for the second time, we're recommending that PABEA support these two bills. The House bill related to rural health care and the Senate bill relating to homelessness on requiring the Office on Homelessness to make an annual report to the legislature. Sarah will submit testimony on both. How do I proceed from here, Chair, on getting approval to support?
No, yeah, so Gary, is HB 1965, the rural health,
Yes,
and SB 2557, the homeless?
yes.
Correct.
Okay, thank you. Is there anything else? Oh,
Just that our next meeting will be April 10th to avoid the state Good Friday holiday on the 3rd. So
yeah,
a week later, April 10th. But yes, going back, seeking approval on those two.
thank you. Can I take out this question now, or can I get a vote?
Think we should do the
Yeah, I
vote
think
first, then
so.
we'll take Audrey's question. yeah.
After. Audrey, we'll take your question after.
Well,
Okay.
actually,
Yeah.
I just wanted to make a clarification to Gary's report about
Yeah.
another bill. Is that,
Okay.
or should I just wait till you guys all take the vote? Because there's a bill that he did miss
Yeah,
of the cryptocurrency bill.
I think that was on the original list. The cryptocurrency.
Well,
Said that the House
original list.
tried.
two different bills on cryptocurrency. I just wanted to point out the second one that is still alive in addition to SB 2387.
Okay,
this must be
but
House
it's-
version.
So Audrey, just for clarification, the House bill died and the Senate one is alive,
The
correct?
one that was a companion, but there's a separate crypto bill that Representative Matayoshi introduced, and that one is still alive.
Mm. So that
Okay,
would be a
so you
eight.
know what,
No.
yeah, I think it would be best if the committee, just to be honest, I think it's good if it comes out as an AARP alert to everybody. to
Okay,
support
I'll
it.
do that.
Okay,
That's fine.
Thank you,
Thank you.
thank you,
Yeah.
no problem. Okay,
I'll let Christina know.
yeah, okay, the Legislative Committee has recommended the addition of HB 1965, Rural Health Care, SB 2557 on the homeless. Because it comes from a committee, it does not need a second. Any other discussion regarding these two additional bills?
We did talk about, sorry.
No, any additional question?
No.
Okay, thank you. Sorry, Sarah. Okay. All those in favor of the addition of these two bills, say aye.
Aye.
Opposed? Opposed, nay? Okay, you've adopted these other two that will be added to the list. And Christina, Audrey will be sending us information about the other currency bill, the cryptocurrency one for us to,
But then-
help,
I'm sorry.
to help support it.
It sounds like, since you guys were at the meeting, they actually did discuss it. Did you guys discuss it?
Discuss what?
The currency.
Yeah, Gary said it too.
Oh, okay.
No, well, I'm confused.
Okay, there's clarification that's being asked right here, is that, did the Legislative Committee talk about
Matayoshi's bill
Representative Matayoshi's bill
for crypto.
on cryptocurrency, Gary?
What is the bill number, Audrey? For,
Matayoshi is House Bill 1642. This is the one that bans all deposits. So this is not
Nope.
the one that ARP crafted. It's the one that Matayoshi preferred, and that's the one he passed out from his committee.
no, we didn't.
You didn't mention
We
it.
didn't
That's fine.
discuss that one.
Okay,
Okay,
that's fine.
thank you. Thank you
I'll
for the
just put it in the chat.
clarification.
Okay,
Okay, thank you. Thank you, Audrey. Plans, Projects Review Committee? Oh, I'm sorry. Yes,
What was the last motion that we?
we adopted HB 1965 and SB 2557 to be on the priority list.
This
That's what you folks talked about today.
25.
57 on the homeless and
Yes.
1965 on the rural
Yes.
health.
Did we not? No, that's already done.
Okay?
But we missed this. Yes, just that new one. We did not talk about.
Yeah.
Okay, thank you. Okay, sorry. Lisa, Plans and Projects Review Committee?
Thank you. We do want to again send shout outs to the AAAs for their reports. We thank you for all your hard work and your activities that are meeting your goals and objectives. This month, we did notice that in the reports, some of the counties were adding information about some of the difficulties that they are going through, and some of it is affecting their activities and their objectives. So what we'd like to suggest is if there are any concerns or issues going on within your county, things like staffing issues or maybe financial issues, or, like Carolyn said, short shortages of providers. If you can include that in your reports, then that way we can kind of see what could be some of the causes for your activities not being completed or your goals not being met, because that would be really helpful information to have. So that's the only request we have for this month. But again, thank you for your hard work and all the activities that you're doing in all the different counties. So thank you again. That's it.
Thank you, Lisa. Rewards and recognition and awards met on Thursday, and I told Rick I would do this for him. Our celebration, we do have a theme. Champion your health. That is the theme for 2026. Okay, so it's champion your health. Our program will be on June 12th at 15 Craigside. Registration is at 10:30. Lunch will be at 11. We will be having entertainment via the Lanakila Multipurpose Senior Center, Happy Serenaders, and James Dela Cruz will be doing the Oli'i. Okay, we had discussion about the size of the picture that the honorees get. That maybe it could be a smaller size that is manageable for them to travel with. Okay, it's a lovely picture, but we just said practicality and everything else, maybe we should look at something that is more feasible for the honorees. The other question came up about the photographer. Was it necessary? And what happens to the pictures that were once taken? And how are those pictures used? Okay. Program deadline, Caroline addressed that today. You told me that you have an intern. There is an intern who is going to be working on the program book with Caroline. And a request was sent to the governor's office for his attendance to come to the program. We also invited the first lady. Okay.
And you dropped the lieutenant governor as a hot rock.
Excuse me. Wait, Caroline, your question first.
And then okay. I know we put in for that. Did we also in the request to Gov also ask for the proclamation? Because if not.
No, it's two separate.
It's two separate.
It's two separate. You cannot ask for the invite and the proclamation. You have to ask. So I went to the proclamation and the proclamation became for somebody like me. I said, I need help for all of this because it's very detailed. So I'll work with you on that. Okay. Our menu, an important part. The menu that was chosen unanimously was short ribs, a wine sauce with mashed potatoes. And of course, you're going to get the greens and the dessert also. Okay. We hope to have the program done by 1:30. And this is March. By the May meeting, we will have a sign-up sheet for the various areas that we need help with. Okay. I'm sorry. Other thing is that we're looking at the medallion and we're saying again, let's be a little bit conscious of what the honoree can use. So we are looking for a different type of a different keepsake for them instead, something that they could use instead. Okay. We also decided that we will get flower lace just for the 8 honorees. Okay. Any questions?
And we're getting lay for other people too?
No. We
haven't
discussed that part, but the flower lace will be just for the honorees. Okay. Because we feel they are the ones we are honoring. And the more you multiply, well, you don't know who you're really honoring.
Right. If everyone in the room is wearing a lei, kind of takes away from it, doesn't it?
Yeah, so anyway, that is our report. Our next meeting is on April 9th at 9 a.m. via Zoom. Okay, thank you. Going on.
Can I ask if you're asking the governor, does that mean you're not asking the lieutenant governor?
Okay, there is a question at the very bottom of the form about the lieutenant governor. You must do a separate request for the lieutenant governor. You cannot make it on the same request. And so the chair will take care of that. Rick will take care of the lieutenant governor's request. Okay, but you cannot make the request on that one form. It's solely for the governor. Okay.
Gary and I had our picture taken yesterday with her.
Oh, very
She
good.
was very upbeat walking around the
Okay.
DCCA.
Good,
thing.
very good. So, okay, going on, unfinished business, we did, legislative committee proposal to add bills to track as additional priorities. We did that already. There was no new business. Okay, PABEA reports. Anybody, public testimony from the public? See none? Okay, Caroline, did you receive any written?
No, I didn't
Okay.
receive anything.
Okay, PABEA reports from appointed members. Okay, seeing none, going on, our ex officio members. Um,
We do have something.
yes,
Did you mention the ex officio report?
yeah, we're starting it right now.
Oh, okay.
Okay, so go ahead, Kathy.
Sorry, I was kind of doing two things at one time.
Okay.
I wanted to announce that Ohana Medicaid's parent company, Centene, has decided not to renew its Hawaii Medicaid Quest Integration QI contract. So this contract expires December 31st, 2026. And Centene and DHS, MedQuest Medicaid had met with the governor to discuss the impact on this matter, and all are working on transition plans. Ohana members will be able to select another QI plan on or before December 31st, 2026. So the current QI plans are Aloha Care, HMSA, Kaiser, and UHC.
Do we know why they're not replying?
Question is, why aren't they reapplying? The question is, why Ohana is not reapplying? Or is it?
I'm unsure, and I don't want to speculate, but it was a decision from their parent company, Centene.
Okay. Okay, Marilyn, anything else? No, okay, thank you. Yeah, I can't, because I don't have a screen. University is, sorry.
Dr. Jordan.
Dr. Jordan, are you there?
I think he is.
I thought I saw him too.
Yeah. Oh,
No,
maybe
that's
not.
not.
I'm sorry.
Okay, so I do know that I saw Paul, I think. No, yeah, Paul is here, Department of Health.
Hi, Paul.
Okay, there she goes.
Hi, I'm so sorry. I'm having technical difficulties today. Goodness. Anyway, I'm sorry. I don't really have any kind of a report for you guys, and I apologize for not submitting anything written to that effect so you knew in advance, but nothing on DOH's end to report.
Okay, thank you. And I know Alan's there, and Alan sent in a report.
Right.
And Alan, you want to just highlight?
Thank you. I gave you the numbers, and just for context, last year we had 7,510 participants. This coming year, our limit so far is 7,127, which means nearly 400. We'll have a drop of nearly 400, 383 to be precise, unless we get further funding later on in the year. That's a cost of the program, and also $50 every year, $50 per purchases less at the market each year. Nonetheless, our local agencies, Hawaii Food Bank and the two community action agencies, MEO on Maui and HCEOC on Big Island, do continue to do the local agency work at a financial loss. each time because of the value of this program to both the elder participants and to the farmers. Uh, very few of the farmers make a lot of money off this. Most of them are very small farmers, and they in every interview I have with the farmers each year, the farmers are very supportive of the program because it helps them sell their produce. So it's a valuable program. I just wish we had more money for it and more money per person to be able to distribute. And as I say, this is one of our elder programs, and in terms of food insecurity, uh, we have at OCS the TFAP program, TEFAP, um, which just will give people tons and tons and tons of canned stuff from the continent. And don't hesitate to contact us for TFAP distribution. Food Bank is the local agency for um, our TFAP program. And um, I've the food basket on Big Island and Maui, the Maui food bank on Maui are the two local agencies for TFAP program, and people can load up lots of the eligibility for TFAP is 300% of the poverty level. So practically even I almost could be eligible for that program, you know, on the basis of state salary. So look at it that way. Any questions? Be happy to try to answer.
Anybody? Okay.
Good report.
Okay. Thank you, Alan.
Thanks, Alan.
Sure.
Okay.
Happy to help.
Okay, I see I'm sorry, Ryan Mandato from DOE. No? Kathy, no? I think Tony, Deborah. Tony, what's that? No, that's.
Sorry,
No.
I meant to make it go to her private, but it ended up going on the group chat.
Oh.
Sorry.
Okay, that's okay. All right. So going on to Janelle from Centers of Medicare and Medicaid Services. Hi, Janelle.
Hi, everybody. Just a couple of announcements. I'm sorry I didn't submit these earlier, but right now there's a new handout for the special election period for incorrect provider information that was on the Medicare Plan Finder for 2026. So what essentially this means is if folks want to switch to a different Medicare Advantage plan or original Medicare because the information that they found on Medicare Plan Finder was incorrect, there is this new special enrollment period, and I will send that to everybody. There is, I was overhearing your conversations and you guys were talking about the enhanced login. So there is a new newsroom article summary that talks about how on Medicare.gov, you can either use ID.me, login.gov, Clear, which is a private corporation that you might have seen them at like the airports. They're like akin to TSA PreCheck. And then for right now, you can still use your regular Medicare login. So that hasn't gone away. Like other agencies, like Social Security and the VA, they kind of sunsetted the original login, and now you have to use login.gov or ID.me. That's probably what's going to happen with Medicare. But right now we don't have like a definitive timeline on that. So that option is still available. But if you go to Medicare.gov, you'll see all the new options. So I will send some information about that. And I did hear that you guys want training on the different login options. So if you want to do that or coordinate that, I'm happy to help out any way that I can. And then last but not least, CMS Region 9, we do a monthly webinar and it's really open to everybody. But the information is especially important right now to beneficiaries. Like somebody was talking about somebody who just turned 65 and they wanted to know about their Medicare options. We go over that and we're doing that between now and May, where we're doing Medicare 101. After May, we're going to have other speakers and other topics that we're going to cover. In June, we're going to do, for example, a collaboration with Social Security, and they're going to talk about what Social Security handles versus what CMS covers and who to go for what. And then based off of the feedback we get from folks, we will be whatever other topics we cover in the future. But the webinar is monthly. It's very short. It's only 30 minutes, and I will send that flyer as well. That's it. Thank you.
Thank you. Any other questions? Any questions for Janelle? Okay. I don't see Dr. Lewis there from UH. Tammy's not there. We got Alan. Ryan's not there. Okay. Agency reports from our AAA agent, AAA execs. As you notice, they are not here in attendance with us. They are meeting to the new computer system is going to be changing over next week, I understand. Okay, just to give you all a heads up, it's going to be starting next week, and the systems will be down for about a week. Okay, so they're just trying to strategize as to what's the best way to keep everybody informed and what there is going on with that. All of them will be, the three of them will be going, the three meaning Hawaii, Kauai, and Honolulu, will be going to Washington, D.C. from the 16th to the 19th for the U.S. Aging Policy Briefing. And the subject matter is health and social care. And they will get briefings on that. It is also their day to go to Capitol Hill, and they will meet with Representative Case and Senator Schatz. And if you had anything real special that you wanted to ask them about their reports, just email them, okay? Rowena, you're on this, aren't you? I thought I saw her on earlier.
She put a note that she had to hop off.
Oh, thank you, thank you. Okay, thank you, okay. Our next monthly meeting will be on Friday, April 10th, because April 3rd is Good Friday. So our meeting is on the 10th at 12 noon. This afternoon, Kapuna Caucus will meet at 2 p.m. via Zoom. And their subject area will be, because we do have somebody coming today. Okay, like wrong paper, hang on. I do have it here. Let's see, MedQuest. Yeah, there'll be somebody from MedQuest. MedQuest more vision. Medicaid update from the federal and state perspectives. MedQuest division of the Department of Human Services. And also the update of the Kapuna Caucus legislative packages. Okay? Oh. Okay. So with that, it is now 1:12 p.m. We will hold this meeting, adjourn this meeting at